Earlier this year, my 77-year-old mother had a heart attack and then heart surgery. Having gone through this with her, I learned an awful lot about heart disease. It really worried me what I found out too, because she had very few risk factors and yet this still happened. This really made me think. I think I lead a healthy lifestyle. I think I have very few risk factors, but what's down the road for me? So when I found out that London Drugs was offering heart health clinics, I decided to take one so I could dig a little deeper into what my risk factors were and what I could do to make sure I never end up needing heart surgery. So Javed, who should come to the heart clinic?
Okay, first of all, thank you very much for coming to our clinic. I normally recommend that if you are 30 years and above 30 years, so it's always a good idea to come to our clinic. Especially if you have a couple of risk factors, like if you are a smoker, if you are overweight, if you have a family history of heart problem, and if you have high blood pressure. If you are diabetic, so these are, or if you are very much stressed. So these are a couple of factors. If you have any one of those, we normally recommend to come to our clinic so we can do your risk assessment for the next 10 years, which we check your blood glucose, we check your total cholesterol, and we also check your HDL, which is like a good cholesterol. And on those numbers, on the basis of those numbers, we're going to tell you what's your risk of getting heart problem within the next 10 years.
So what will people leave the clinic with besides a Band-Aid from the finger poke?
Okay, normally we give them a plan. We tell them what their risk factor, their risk is within the last 10 years. And along with that, we just suggest them that how they can prevent it. So we tell them what kind of food they should eat to prevent it, how they can be physically active, right? And then the third thing, how they can relieve their stress, and if they're overweight, how they can lose weight. So these are the couple of things we tell them. And if there's some issues we need to refer to the doctor, we can refer to the doctor as well.
What happens, today, I know the London Drug stores have one planned, usually each store has one day. What if people find out about this, say in Chilliwack, because that's where we are, and they miss the day? How can they come back and take the clinic or get a consultation at a different time?
Actually, what we do at the moment, we are doing at a different store at a specific date, but they can phone us, and if we have like more than 5 or 6 or certain numbers, then we can do the clinic again.
Okay.
So if somebody want to come and we have that specific number, then we can come again and we can do the clinic.
So just to emphasize, you might think you're really healthy, you might think that you exercise and eat well, but you don't really know until you do the actual test to find out what your body, your blood chemistry is telling you, right?
Yeah. So this is the most important thing, because most of the people, they think, oh, they are pretty healthy because they're doing very well, they don't have any issue. But the only thing is, that's what we say, this is like a hidden thing. So unless you come to the clinic or you go to the doctor, unless you check it, whether your HDL or your LDL or your total cholesterol is high or low, and keeping in mind all those numbers, when you come to our clinic, we actually tell them, okay, your numbers are okay or not okay. If not okay, how we can improve it, right? If you know that you may have this condition, then you can prevent it. But if you don't know, then it's very hard. So it's always a good idea, if you are 30 years old or more than 30 years old, come to our clinic, and we can help you to prevent the heart problems.
Great, thanks a lot.
Thank you very much. Thanks a lot.